Good evening, everyone. My name is Adora Nana, Doctor of Nursing Practice student at Brandman University. Today, I'll be presenting plan for the stakeholders for my clinical scholarly project. I will talk about my project, which is reintroducing diabetes self-management education for patients with type 2 diabetes, the identified stakeholders, and the important role they will play in this project. I will also discuss the theoretical and conceptual framework and my plan for implementing this project. Diabetes is a chronic disease that affects glucose metabolism. According to the Centers for Disease Control and Prevention, approximately 30 million individuals in the United States have diabetes mellitus. Of the 30 million individuals with diabetes mellitus, 95% of them have type 2 diabetes. My project will focus on patients with type 2 diabetes. There are complications associated with diabetes mellitus. For example, diabetic retinopathy, peripheral neuropathy, chronic kidney disease, heart disease, diabetic neuropathy, gastroparesis, lower limb amputation, macular degeneration. The complications are expedited when patients do not maintain good glycemic control. Glycemic control is defined as glycated hemoglobin or hemoglobin A1C less than 7. When patients have the hemoglobin A1C greater than 7, the complications of diabetes are expedited. Management of diabetes requires commitment on the part of the provider and especially the patient also to achieve glycemic control. Diabetic self-management education, DSME, is one of the ways that we empower patients to care for their diabetes, to care for everything that have to do with management of their diabetes. However, according to market scan data, not all patients diagnosed with diabetes have access to diabetes self-management education or are referred to by the provider for diabetes self-management education. In order to manage type 2 diabetes, the biggest stakeholder that I've come to see is the patient. The patient is the biggest stakeholder in that diabetes is one of those diagnoses that require self-management in order to achieve glycemic control. The provider is also another stakeholder that has been identified. The primary care provider, be it the PCP, the nurse practitioner, or whoever is caring for the patient, should be able to identify the patients that require diabetes self-management education. I actually believe that at baseline, all patients diagnosed with type 2 diabetes should be referred to diabetes self-management education. For my project, after extensive literature review, I've decided that I will implement it using a CDE who is also a pharmacist and the staff at the primary care physician office. My plan for education for these stakeholders will be for the primary care physician to make him understand the importance of referring patients to diabetes self-management education. For the patient, I will inform the patient and educate the patient on the implications of uncontrolled diabetes, the importance of following the steps of eating right, of doing all the steps of diabetes self-management education. For the office staff, I will educate them on the inclusion criteria and exclusion criteria of the patients that are needed for this project. I will also educate them on the importance of being supportive to the patient when they come to the office. I plan on adding a smart meter to the diabetes self-management education so that we can see the blood glucose of patients in real time and be able to intervene if the blood sugar is out of control before the 3 months that is needed to check the A1C. The other stakeholders are the manufacturers of the eye glucose meter, which is Smart Meter Corporation. I've talked to them and I'll be acquiring the meters needed for the patients at a lower cost. I will also educate them on the importance, because the meter is not widely sold at every drugstore, of providing the diabetes supplies that are needed for the patients. The class will be held at a community library in Northeast DC. I've also educated the administrator of the library on the importance of the patients having a conducive place for classes to be done. The theoretical foundation and conceptual framework that I plan on using for this project is the Schuler Nurse Practitioner Model. The Schuler Nurse Practitioner Practice Model was developed by Pamela Schuler and is geared towards nurse practitioners, other clinicians, and researchers. The Schuler Nurse Practitioner Model is built upon the wellness theory, the nursing process, and is organized within the systems theory. The systems theory that it was organized is the one by the biologist Ludwig von Bertalanffy in 1936. Schuler's conceptual framework evolves from paradigms that have been used in nursing, for example, developmental, growth and development, structural functional view, open systems, input and output, energy response to the environment. The assumptions of the model that people have the right to accept and reject care, as with diabetes self-management education. The practitioner and the patient are partners in healthcare and interdependent in this relationship. So it's important for the nurse practitioner and the patient to be partners, or the provider and the patient to be partners. And nurse practitioner will assist the patient with wellness, health promotion, prevention, maintenance, and restoration through self-care activity, as with diabetes self-management education. Applying the Schuler Nurse Practitioner Practice Model to the CSP, the output will be glycemic control. The model receives feedback internally and within the systems and the environment. The input will be the DSME and individualized education and support for the patient with uncontrolled diabetes. And the throughput will be extensive education of all the stakeholders on the process required to achieve this set goal. The outline for delivering the intervention is as follows. As mentioned earlier, the CSP will be implemented in the suburbs of the state of Maryland and southeast and northeast of Washington, District of Columbia. I have begun plan for recruitment, as I volunteer with a community health worker and a certified diabetes educator in Washington, D.C. to facilitate a diabetes prevention class. This diabetes prevention class that I help and volunteer at is aimed at preventing and slowing down the conversion of prediabetes to diabetes. The patient with uncontrolled diabetes will be recruited from referral to the certified diabetes educator. Also, adults with uncontrolled diabetes type 2 will be recruited via a private practice in the state of Maryland. The physician will identify the patient with persistent uncontrolled type 2 diabetes without cognitive deficits that fits the inclusion criteria, which is non-pregnant adult 18 to 100 with type 2 diabetes on oral hypoglycemics or insulin, and they will be enrolled in the program. In collaboration with the practice manager and medical assistant, the patient will be contacted and the CSP will be explained. The patient will receive all instructions and receive a smart glucose meter. The eye glucose meter, as mentioned earlier, is from Smart Meter Corporation and will be used to monitor and give immediate feedback to patients if their blood sugar reading is not within target. In conclusion, I hope you guys see the importance of diabetic self-management education and the importance of educating the stakeholders in this project. Thank you.